With more than 350 cases of measles nationwide, including one that led to the death of a child in Texas and 4 confirmed cases downstate in and around New York City, the governor is sounding the alarm. Gio Battaglia spoke with a local pediatrician about the importance of timely vaccinations and the best ways to stay safe from a potential spread. Gio.
Teresa, the pediatrician I spoke with says despite the high contagiousness of measles, it is preventable through the MMR vaccine, which is given in 2 doses. The first between 12 and 15 months old and the second at 4 years old. She stressed the importance of making sure kids are vaccinated, and there are outreach efforts being made to families to let them know there is still time.
It's very contagious. So it's spread through direct contact with infectious droplets from a cough or a sneeze and through the air.
Dr. Sarah Collins-McGowan says the virus can remain infectious in the air for up to 2 hours after a person has left a space. She says pediatricians are watching this closely.
In the pediatric world and the medical world in general, we are concerned about the possibility of spread and outbreak.
Governor Kathy Hochul, alongside State Commissioner of Health James McDonald, are also worried, saying they are doing what they can to prevent an outbreak.
The number I want to see is over 95%. What I have in New York State right now is 81.4%. What we see though is in New York, people are getting their vaccine eventually. So by kindergarten, I need you to have 2 doses.
While contagious, Dr. McGowan says preventable with the vaccine and warns of signs to look out for if you feel you are getting sick.
Typical symptoms are fever, runny nose, cough, pink eye. You can get some white spots in the mouth, and then a rash is kind of a classic symptom that starts on the head and spreads downwards, so spreads down the body, down to the legs over a couple of days. And in terms of complications, the kinds of things that we worry about or that we see would be, dehydration, especially in young kids with fevers. That tends to be a problem we run into. And so I think that's the really good news here is that we have the tools that we need to, to protect our community.
Dr. McGowan also advised to regularly check immunization records to make sure you are up to date. The state also has launched a new web portal to support access to vaccines and public health information in the wake of measles cases. We have a link to that over on our website. Teresa, back to you.